Good afternoon. I'm BC Health Minister Adrian Dix. Beside me is Provincial Health Officer Dr. Bonnie Henry. It is, we're honored to be here on the traditional territory of the Algonquin-speaking people, and wanted to note that tomorrow we'll be holding our press briefing, our daily press briefing here in Victoria, on Friday at Vancouver Cabinet offices, both at 3:30, and on Saturday if required. And with that, I'll introduce Dr. Henry to provide an update.
Thank you. So we have an additional 7 new cases today to bring our total in British Columbia to 46 people who have been diagnosed with COVID-19. To start off with, I'll give you a bit of an update on the Lynn Valley Care Centre outbreak. We have 2 additional healthcare workers from the Lynn Valley Care Centre who have tested positive. They're a male in his 50s, or a male in his 20s who lives in the Vancouver Coastal Health Region, and a woman in her 50s who's in the Fraser Health Region. And both of them are recovering in isolation at home. And the respective health authorities are doing their investigations to determine if there's any additional close contacts. Other than that, things have settled and are still being monitored very closely at the care centre, and in particular residents are being monitored every day, as are the healthcare workers. We have a number of returning travelers who have tested positive today, and 3 of them have travel that's related to Egypt right now. So one is a Vancouver Coastal Health a man in his 70s, and he's related to the traveler from Egypt that we reported yesterday. And an additional, for the first case it's a presumptive so far, but we expect it will be confirmed at the BC CDC. There's a man in his 60s who also was on the same traveling group in Egypt, who's here on Island Health. Additionally, there's a person who lives in Egypt, a man in his 70s, who is visiting here, visiting family in Fraser Health, as tested positive. So there's a number of family members who are also in isolation. He's in isolation at home and being cared for, and the family and the close contacts are all in isolation and being monitored by Fraser Health. So finally, we have 2 additional cases that have just arose today from our surveillance that we're doing around respiratory diseases. So from influenza testing, that's automatically. COVID testing is done, and so those are our 2 new community cases. They're both in the Fraser Health region. One is a woman in her 60s, and unfortunately she's at the moment in hospital, although in stable condition. And the other is a man in his 60s who's in isolation at home. And as you can imagine, as we've discussed before, detailed public health investigation is being done on both of those cases, as well as the 2 that we had yesterday, to try and determine the origin of their infection. On the positive side, we talked about yesterday, there was a man in his 90s who had been admitted to hospital, and he has improved and is now discharged from hospital and at home. There was a woman in her 60s who had been on the Grand Princess, the cruise from the 11th to the 21st of February, and she also has been discharged home. So that's really good news. We also reported yesterday that our case 21, our first community case, is the healthcare worker who works at the Lynn Valley Care Centre, had been admitted to hospital a few days ago, and she also has been discharged home. So that's positive news for all of those people and their families. So really, today there's been a couple of events that have happened. One is, of course, the declaration of a pandemic, and I'll talk about that in a minute. One of the things that has become apparent to us is how fragile our long-term care system is, and how we need to be doing more to enhance our prevention of people in long-term care and our assisted living facilities. Given what we have talked about before, what we know about this virus and how it can affect our elders and seniors in our community, and how it can be devastating in that case. We've had some really great stories of older people who've been infected, who've done well, and I think that's really great, and it reflects the fact that we have a healthcare system that's been able to provide the care they need. And we need to do everything we can to ensure that that continues as this progresses around the world and here in British Columbia. So part of our efforts to contain this spread will be implementing measures in all of our long-term care homes, and things like enhanced screening of visitors who are coming in, I won't say stopping of visitors, but restriction of visitors, making sure that nobody comes in that has any respiratory infection, making sure that we don't do things like have group sessions where people are interacting with multiple people. So you go and you visit your own family member. You make sure that you take all the precautions that we know are important at preventing transmission of infection, like cleaning our hands and really, really particularly staying away if you're ill. We'll also be looking at enhanced screening of healthcare workers as they go to work to make sure that they are checking themselves, monitoring for any symptoms they might have. So these are all things that we do on a regular basis during influenza season, but we need to make sure that everybody is aware of it, and we step that up right now with the issues that we know are going on in our communities and with the fact that we do already have an outbreak in a long-term care home. We have a stakeholder working group that's involved with all of the long-term care homes and assisted living committee leadership, and we'll be communicating with them in the next days about how that will look and how we can support them in the system to make sure they have the tools that they need to be able to do this in the best possible way. We are also looking at, so the pandemic declaration is something that's important. It's something that we've been talking about for several weeks. We have watched this virus increase and cause outbreaks and sometimes severe community outbreaks around the world. And I think we've learned a lot from the countries that have been dealing with this ahead of us. We know, if nothing else, the measures that were put in place in China have bought us the time to understand more about this virus than we would have several weeks ago. And what we do know is that it's not inevitable that everybody is going to be infected with this, that it's not inevitable that our systems are going to be overwhelmed. We do not have to be in that position. And I know that we can take actions now, and we will be taking actions now to do everything we can to continue to contain, to stop those chains of transmission, to manage every outbreak as it arises and as we detect it, and to do everything we can to draw this out, to delay, and to ensure that we have a health system that's able to care for people who have COVID-19, but also care for the rest of the people in our communities that need the care and the health care that in our system. So we are, and we must all, at this time, step up our social distancing. This is not forever. This is for the coming weeks. The coming weeks where we know we have to do everything we can to prevent transmission of infection in our communities, to protect those people who are more likely to have severe illness, and particularly our seniors and elders. So right now, I'm asking everybody to take those measures, to increase your distance between people, to look at gatherings where you can stay apart from others, to clean your hands regularly, to cover your mouth when you cough, to stay away from others, even if you have the sniffles right now, to stay away from others and prevent the transmission of infection. And these are the things that we can do in our communities and our families to keep us safe through this time.
Thank you very much, Dr. Henry. It's, as Dr. Henry has noted, that's 7 new cases today. That's 46 across British Columbia. In terms of health regions, that's represents 22 in Vancouver Coastal Health, 22 in Fraser Health, 1 in Interior Health, and now 1 in Island Health, noting that 4 of those in Vancouver Coastal Health have had their cases resolved with 2 consecutive negative tests. Just to put in context what we've seen, that 5 have been related to cases to travel to China, 16 to Iran, 1 is the trip you know of from Hong Kong and India, 1 from Washington State, and then a number from Egypt and other places. I think that what Dr. Henry has said today on the good news side is that this continues to be a very significant challenge here in British Columbia, a major one, and the declaration of a pandemic worldwide underlines that. But it's a challenge that's taking place in the community. We currently have one case and one only in acute care. Obviously, one individual passed away. We have 2 residents of the Lynn Valley Care Home amongst those 46 cases. But this is a case in the community. So aside from those cases, the remainder are in isolation at home. And we continue to make significant efforts to deal with that. And note that the 2 new community cases both stem, as Dr. Henry has suggested, from our surveillance of influenza cases in British Columbia. So they were done as we tested for influenza over the last number of weeks now, just like in the case of case 21. We are testing everyone who's tested for influenza for COVID-19, and that's how those were picked up. On a couple of issues, the Lynn Valley Care Center, and there's significant interest in how staffing is going. Staffing continues to be very steady and very good, and the situation has improved. We've added, as we said yesterday, both infection control staff and communication staff to improve communications to the families involved there. Dr. Henry has noted this, and I think this is important as we seek to support each other in this challenge, is that we're upping our controls on long-term care centers. That communication is happening with with major groups representing providers now, the BC Care providers and others from the Ministry of Health, and we'll be working over the next 24 hours to ensure that new levels of controls of visitors and others are put in place at long-term care centers. This reflects the fact, what we know, which is those that are most vulnerable from this are those with underlying medical conditions and those people that are older. We'll be reporting on Friday on the number of tests by the BC Centers for Disease Control that they've processed both at their center and at 4 centers around BC. As you'll note, last Friday we more than doubled the number of tests over the entire previous period, and again we'll have more than doubled the number of tests from the entire period in this 1 week. I wanted to say with respect to 811, there have been some issues with respect to 811. I want to note that yesterday I said I think we were up to about 3,600 a day. It's now over 4,000 calls a day, and we are adding new resources to 811 in order to help address those questions, which is one of the main ways that people can get in touch with the healthcare system and get advice. We're asking everyone, of course, who needs support, especially with respiratory conditions, to contact us through 811 or through their primary care provider. And it's important that when they come in to be tested, the healthcare workers are protected, and they are protected, and the public is protected from transmission. And finally, I want to say that we are, of course, appreciative of the announcement by the federal government today of new resources. I think that's an important step and demonstrates the work that we've been doing together, Dr. Tam and Dr. Henry at the medical officers level, Minister Haydu and myself at the minister's level, and of course the Prime Minister and Premier Horgan at their level. Note that we have submitted our requests, which are focused on PPEs and swabs, but in terms of getting materials at the moment, and we're obviously building. We have resources for the healthcare system in case of pandemic, but we obviously want to continue to build out those resources and are working with the federal government to do that. And we are very appreciative of their support, and in particular their support for workers in Canada and in British Columbia. So finally, I think what this shows, this continues to be a major issue in our communities, the declaration of a pandemic by the World Health Organization, the fact that we all can be part of this work together of containing and slowing down the virus here in British Columbia. And that means, and we've said this before, staying home from work when you're sick, staying home from school when you're sick, and there's some things, especially on the work side, that the federal government has done today that assist with the economic challenges of that. Staying away from long-term care when you're sick, which is absolutely critical. Staying away from visiting people in hospital when you're sick is very important, and engaging in social distancing. Today, the Premier and Dr. Henry and myself met via teleconference with 128 faith leaders and reiterated those things, and we were impressed by the efforts being made around British Columbia by faith leaders in communities, that they're listening to the messages, particularly those delivered by public health officials in their practices, and showing great leadership in their communities. And with that, we're happy to take questions.